So good things happening here at Pulmonary Wellness. People have been asking me to post previous webinars online, which we have not done until now because I felt guilty about the bad sound last time. I have posted 2 webinars on our YouTube page, which you can access through our website, www.pulmonarywellness.com. And also, if you go to our Facebook page, which you can also access through our website, you can see a great story that was done about the Pulmonary Wellness and Rehabilitation Center by Dr. Sanjay Gupta. So, you know, you could really get kind of a more personal feel about what we do as opposed to sort of listening to me tell stories about it. And essentially, you know, what I really want to do is I'm going to make the information available to you. We were initially thinking about figuring out a way to pay-per-view it, but we were competing with, you know, other cartoons and things like that. So our YouTube page does have the webinars 1 and 2. So webinar 1 was Ultimate Pulmonary Wellness, in which I outlined the overall concept, and webinar 2 is Better Breathing Techniques, and they're all close to 2 hours long. So enjoy it, and I'll talk a little bit about the disclaimer. So when you give a webinar like this to hundreds of people, which is what we do, please don't take what I say as instructions saying, you get up out of your seat right now, go to the refrigerator and take out the carrot sticks. There's very difficult, if not impossible, to give you advice that is going to be meaningful. It's going to be meaningful to you, but it's not individual advice. And that's why anything that I discuss, please understand that that is based on my own personal experience with my own patients here at the Pulmonary Wellness and Rehabilitation Center. I mention this all the time. Most of what I know, the overwhelming majority of what I know, I've learned from patients. So I think it's good information, but everybody is different. I don't know your medical history. I don't know what medications you're on. I don't know what your current diet is like. And I don't know how old you are, what gender you are, what kind of foods you like, and what your favorite movie is. So please understand that anything I say are ideas. Please discuss them with your physician. Please discuss them with your healthcare team. Don't say, Noah told me to do this. Okay, other things. So let's start now. So this is not going to be a classic nutrition lecture where I say eat 7 Ritz crackers and 1 tablespoon of peanut butter. What I really want you to understand is how does nutrition and digestion and the act of eating and the timing of eating affect how you feel and affect the activities that you're able to do over time. So in the same way that we talked about medications, okay, how you use your medications and the timing of your medications and the technique of your medications affects the way you breathe. Same exact thing with food. So even more important than me giving you a list of what you should be eating for breakfast, lunch, and dinner, if you understand these concepts, they will help you make the good decisions for yourself. And if you need somebody to actually sit down with you, then I recommend making an individual appointment with a nutritionist. So without further introduction, let's go on. Relax, nothing is under control. That's great. And the reason why I say that is because if you can relax knowing that you really have very little control over most things, then you're doing better than most of us. So now let's talk a little bit about nutritional issues that either directly or indirectly affect and are affected by breathing. So what I'm talking about now is there's some nutritional issues, some digestive issues, some food issues that are going to directly affect your breathing. Some are going to have an indirect effect. Some are going to have an immediate effect, and some are going to have an effect over time. And that's what I'm going to talk about tonight. The other thing is that there are certain nutritional issues that are going to be affected by your breathing, and we'll talk about those as well. I mention every week the fact that breathing is multifactorial, and what I mean by that is that there are so many different factors involved in how well or how poorly you breathe. We tend to think of it as only the condition or the function of the respiratory system or a pulmonary function, and I've talked about this numerous times, but I'm going to just say it again for those of you that aren't here. You can go to your doctor and you can say, I feel much more short of breath than I was a month ago, and your doctor can repeat the pulmonary function test that was done a month ago, and we can see no change in it. Okay? It could be exactly the same, yet you feel more short of breath. Or it could be, you can go and you can say, I feel much better than I did a month ago, and there has been no improvement in pulmonary function. And so the point of that is that there are many other factors involved in how well or how poorly you breathe other than the function of the respiratory system. And that's the whole idea behind Ultimate Pulmonary Wellness. It's trying to get you to be aware of all of these various lifestyle issues, things like exercise, things like stress management and anxiety control, things like using your medications properly, things like nutrition, because all of these have an impact, and understanding how they work is really important. So just very quickly, if we talk about the respiratory system, and we talk about it quite often, but just take a peek at this. I want to review. Air can enter our body in two ways, okay? Essentially, it can enter through our nose or our mouth. If it enters through the nose, three very good functions occur, okay? The air is warmed, the air is filtered, and the air is humidified. So what this is doing is essentially, this is making the air very usable by your body. Not to say that it can't be used if it comes in through the mouth, but by breathing in through your nose, it makes it more tolerable, more enjoyable for the body to use. Once it goes past the nose, it goes through what's called your nasopharynx, or it can enter through your mouth and go past what's called your oropharynx, and those two will join in the back through what we call your pharynx, okay? So then it's going to come down here, it's going to go past your larynx, which is your voice box, and it's going to go into your trachea, which is your windpipe. From the trachea, it's going to come down, it's going to split into the right and left main stem bronchi, or airways, okay? When we talk about bronchi, we're talking about the large airways of the respiratory system. The bronchi will continue to branch, as you see here, into smaller and smaller bronchioles, and finally they will end at the alveoli, and the alveoli are the air sacs, okay? We've spoken before about how the body responds to rises in carbon dioxide and then to drops in oxygen. And when that happens up in the brain and the brain senses these chemical changes, it sends a signal to the diaphragm. The diaphragm is the main muscle of inspiration. The diaphragm contracts downward, and that creates a negative pressure, and that negative pressure inflates the lungs, okay? Just a quick review of respiration. Now, keep the main thing the main thing. And the reason why I say this goes back to the fact that breathing is multifactorial. So if you come in and the problem that you're having is airway irritability and airway inflammation because your asthma is not well controlled, then we have to address the fact that you have increased inflammation and irritability in your airways. Tonight we're going to talk about nutrition, and we're going to, Chris, you are somehow affecting my slides. Yep, I think so. So, okay, so we're going to talk tonight about what is really the main thing. So a lot of times people come to me and they say things like, I'm more short of breath, and why am I more short of breath? And we talk about the fact that generally people start to get short of breath at high levels of activity. They find ways to avoid those activities. So the thing that I hear most often in New York City, walking uphill, climbing subway stairs, running for a bus. So generally, if people start to avoid the activities that cause them discomfort, all the muscles they use to do those activities get weaker. The body doesn't use oxygen as well, and then you start to get short of breath at lower levels of activity. Very often, people will come to me and they are either significantly overweight or significantly underweight. And sometimes carrying around that extra weight can be the main issue. So if 50 extra pounds is your problem, then sometimes just taking off those extra pounds can be enough to eliminate your breathing problem. If inactivity is your problem, then we need to get you moving. If not taking your medications properly is the problem, then we need to teach you how to take your medications properly. And if anxiety is the problem, then we need to give you some greater control over your breathing so that you become less anxious. My point in saying keep the main thing is that we need to get to know you, and your medical team, your doctors, your nurses, your therapists, your so on and so forth, they need to know you very well personally, because there's no one size fits all when it comes to respiratory disease. Aside from shortness of breath, which almost all of my patients suffer from, no two people experience respiratory disease in exactly the same way. And so one thing that's very important for my team to do is we want to know every patient personally, and we want to know, do you live in a 5th floor walk-up? Do you have a country home with 3 flights of stairs? Do you live outside of an area where there's a lot of pollen or pollution or mold or things like that? But the point is we need to figure out what is the main thing and then to focus on the main thing. So when we talk about nutrition, I'm going to talk tonight about nutrition, I'm going to talk about digestion, I'm going to talk about the whole concept of getting food, eating food, preparing food, cleaning up after yourself, things like that. But essentially, if we're going to say one thing, okay, the purpose of nutrition is to provide fuel for all body functions, okay? And that means all metabolic functions. And most importantly, when it comes to respiratory disease, one of the things that you'll see for people who don't have good nutrition, okay, or who aren't well nourished, or for people who are overnourished, is their ability to fight infection is severely compromised, okay? And good nutrition can mean many things to many different people, and we're going to talk about these things. But essentially, the purpose of eating, and the reason why we should be eating, is to provide fuel for all metabolic functions of the body, particularly as it relates to respiratory disease, to fight infection, also to provide strength for any activities of daily living. When we talk about metabolism, okay, essentially we take in food and we take in oxygen. That's our fuel. And the byproduct of the food is going to be energy, and the byproduct of respiration is going to be carbon dioxide. So essentially, we take in food and oxygen, which is our fuel, we provide energy, which is what we're going to use to do our activities, and we're going to release carbon dioxide, which is the waste product of metabolism. This is a concept when I talk about the digestive impact on lung mechanics, okay? This is, I could also reverse this and say the impact of lung mechanics on digestion. But this is something that is so crucial, okay? What happens a lot of times, patients will say to me, last night I took my wife out to dinner. We went to a restaurant and we walked 5 blocks to the restaurant and I felt great. My breathing was good, I felt strong, I was able to walk to the restaurant without a problem. Walking home, I could barely walk a half a block and then we had to get in a taxi. How many people have had an experience like this, okay? It's not uncommon. And you say, well, what happened during the course of that meal? Let's talk about some of those things. And it only makes sense to start with one thing, and we're talking about the mechanics of respiration. So if you look at the picture that is on your screen right now, essentially that starts about here. And I already told you that the way that respiration occurs is the diaphragm needs to contract downward. That is the main muscle of inspiration. So if you look at your screen and you look at the liver, and you look at the stomach, and you look at the colon, which is the large intestine, and you look at the small intestine, okay? All of that stuff is taking space. And so if we think about this here as the thoracic cavity, okay, and the thoracic cavity has something associated with it called intrathoracic pressures, and then we think of this as the abdominal cavity, okay, and we have intra-abdominal pressures, and we'll talk about things that will raise or lower intra-abdominal and intrathoracic cavities. Think about it like this. Imagine this is a suitcase, and this suitcase is flipped open on your bed, and you're trying to pack this side, and this is the side that you pack air in, okay, or you want to pack air and blood in, and this is the side that you want to pack these abdominal contents, your food and liquids and things like that in. And just think that the more you pack into each area, okay, the more the pressure is going to increase in your suitcase. So if the more you pack in here, the greater your intrathoracic pressure. The more you pack in here, the greater the intra-abdominal pressure. And just think about the fact that very often increasing the pressure in one will actually increase the pressure in the other. And the other thing is that the more room you take up with one, the less room the other one actually has to do what it needs to do. So let's talk about that a little bit. So let's say you went to the restaurant. How many people went out to eat this week? Okay, so we have some people here who did go out to eat. Bob went out to eat. And did you start with drinks? Yes, we had a couple of drinks to start. We had a glass of wine, and we're going to talk about alcohol later on, okay? But here are some things that should start going through your head. So we're talking about drinks. So I'm thinking, what is the drink? What's in the drink? Okay, is it alcoholic or non-alcoholic? Is it caffeinated or not caffeinated? How much space does it take up? Okay, is it a fluid? Is it water? Does it have calories? Does it have a lot of calories? So that's one thing we'll talk about individually as we go along. Did you have an appetizer? Yes, we had shrimp cocktail. How was it? It was great. It was the biggest jumbo shrimp I've ever seen, okay? So now we've already poured in some drink, okay? So here we'll make it red. Red wine is taking up some space over here. Okay, we got shrimp cocktail taking up some space over here. And then what did you have for dinner? You had, okay, pasta with chicken. Okay, and here we have pasta with chicken. Now, we are broadcasting now to 49 states. Hawaii, please get at me, okay? I want to be able to say all 50 states. So if you know someone in Hawaii, please get them to log on, okay? So here's the thing. In New York City, when you go out to dinner, and I'll say Texas, I know I've been out to dinner in Texas and it's similar out there, you don't have the amount of pasta that you're supposed to have, okay? When you go out to dinner in an Italian restaurant in New York City, you could have a pound of pasta on your plate, okay? So think about the fact that that pound of pasta is taking up all this space down here, okay? And that pasta now, when you want to take a breath, that is resisting the diaphragm from contracting downward, okay? Same thing, the more liquid you put in here, the more this space is filled up. Did you have dessert? Yes, as a matter of fact, we did. What did you have for dessert? Well, I had a piece of blueberry pie, okay? And now what we've done is we've super jacked up and now we're just talking about physical space. We're talking about physical mechanics of eating, okay? So now this is all full. What do you think happened to our intra-abdominal pressure? Went up, okay? And this will have the impact of also pushing the diaphragm up higher, okay? And if the diaphragm is pushed up higher, guess what that's doing to your lungs? It's pushing them up higher. So now think about the fact that you want to breathe in 6 liters of air per minute, right? So if we're taking, let's say, 500 milliliters of air per breath, we can get that 600 liters or that 6,000 liters or that 6 liters of air in only 12 breaths. But imagine that all this food is now pushing up on my diaphragm, and my diaphragm has to work that much harder to actually contract downward, and maybe now I'm only getting 250 milliliters of air with each breath. What that means is that I now have to breathe 24 breaths per minute instead of the 12 breaths per minute, which is very comfortable for me. So now I've doubled my breathing rate, okay? Now imagine if it's even smaller. Imagine if you've gorged yourself, okay? Imagine if you haven't eaten all day and you've just gone out and now you're sitting back and you feel like your stomach is out here, okay? All this is pushing up, and now we're only getting 150 milliliters of air with every breath. That means that in order to get that 6 liters of air for your body, you have to breathe at 40 breaths per minute. And you know what 40 breaths per minute looks like? And do you think that that's going to increase your anxiety? Absolutely, because you don't even know why that happened until now, okay? You went to the restaurant, you thought you were fine on the way out, you gorged yourself, okay? And now you're starting to walk home with your wife and you can't breathe, okay? Now we're anxious again. Remember this cycle that we talked about during Better Breathing Techniques, which incidentally, Better Breathing Techniques is now available on our YouTube channel. Go to www.pulmonarywellness.com, click on YouTube, it's at the bottom. Shameless plug over. Okay, next order of business. Now we're anxious. Now our body's putting out adrenaline, and that adrenaline is saying to your body, breathe, 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 breathe. All because of the physical mechanics of having that extra food in your stomach, having that food increase the intra-abdominal pressure. That abdominal contents is now pushing against the diaphragm. The diaphragm has to move up, encroaching on the lungs, okay? Does that sound familiar to anybody, okay? It sounds familiar to me, and I don't have a pulmonary disease, okay? So keep this in mind. So we have to, now that we understand how this works, come up with a strategy. And the strategy is, instead of having 3 giant meals per day, okay, which is, you know, this is what we do in this country, you need to start breaking that up into frequent small meals. And I wouldn't even think about it as meals. I think of it as feedings, okay? Because, you know, don't get the idea that I'm saying the zookeeper is coming to give you your nuts. But what I'm saying is that you need to be putting something in your body every 2 to 3 to 4 hours. But by doing it in a small way, by taking up much less space, okay, you give your body the opportunity to process that food more effectively in a way that's not going to encroach upon your respiratory system as much as having that one big meal, okay? So now we're going to talk about a few other things, okay? It doesn't matter what form this takes, okay? So we're packing a suitcase, okay? When you're packing a suitcase, we're talking about space and size and volume. So it doesn't really matter if it's a shirt or a jacket or a pair of pants. The larger the volume, okay, the more space it's going to take. And it's the same thing with the abdominal cavity. So when we talk about this, we can essentially be talking about, you know, matter has three states. So it could be a gas, it could be a liquid, or it could be a solid. So when we talk about solids, we're talking about food. When we talk about a liquid, we're talking about what we drink. And when we talk about air, okay, now we have to think about things that are gas producing and bloating. So how many times, okay, have you had a meal that was very gassy, or you've had some food that was very gassy, and now, guess what? We've got air in our stomach, okay? But we've also got these beans, or this cauliflower, or whatever food it is that makes you gassy, okay? And everybody's different. So again, I'm giving you general principles now, okay? But the body doesn't really care if it's liquid, solid, or gas, okay? If it is taking up space in your abdominal cavity, in your stomach, in your intestines, so on and so forth, okay? It is going to increase the intra-abdominal pressure. It's going to push the diaphragm up, encroaching on the thoracic cavity, increasing your intrathoracic pressure, and making it more difficult for you to breathe. Okay? Does that make sense? So here's some strategies. We've already talked about one. Instead of having 3 large meals per day, I want you to start breaking that up into 5 or 6 smaller meals or feedings per day, preferably 2 to 3 to 4 hours apart. Okay? When it comes to gas and bloating, the obvious is to take, to avoid the foods that cause you gas and bloating. Okay? But there are some other things that you can do. One thing is there's a product on the market called Beano, which you can add to your food, and that will actually increase, or rather decrease, the gas and bloating. But start to get the idea now of what I'm talking about, and realize that why you're getting short of breath may be related to your respiratory system, but in many cases, especially in these individual cases, it's also behavioral, and you can start to see the effect of having that extra food in your system. Fiber, okay? Now, a lot of the topics I'm going to talk about now, what I'm talking about is, some of them are individual topics, okay? But what they really are these are the things that people often don't talk about as they relate to respiratory disease. Over the years, we've had at least 7 different nutritionists working with us here, and it's hard to get it to work out, mainly because a lot of nutritionists and a lot of people really understand the nutrition as it relates to cardiovascular disease, because so many people are overweight and have cardiovascular disease. But a lot of people don't put 2 and 2 together and say, hey, maybe nutrition also affects pulmonary disease. When we talk about fiber, okay, you want to try to increase the amount of fiber in your diet, and the reason for that is because you want to be able to pass food through your system effectively. So, in other words, let's talk about constipation for a second, and it's something that most people don't really like to talk about, but imagine, and I've seen this happen, I've had situations where a patient comes into the pulmonary center, say, how do you feel? Well, I'm having a little GI upset. And I say, well, what is it? Are you constipated? Do you have diarrhea? Are you having cramp? I say, I'm constipated. I haven't had a bowel movement in 3 days. Okay? Can anyone relate to this? Okay? You don't have to tell me. It's okay. But imagine that you now have 3 days worth of food in your intestines. Okay? Imagine what that does. Imagine how that compounds the situation that I just talked to you about, where your intra-abdominal pressure is now tremendous. Okay? And your intra-thoracic pressure is now tremendous, okay? And so now you can theoretically, over the course of those 3 days, be getting more and more short of breath as time goes on. The more pressure increases here, the less room for your lungs to expand, okay? And here's something else that has an impact on. The pressure in the thorax and the abdominal cavities play a tremendous role in blood pressure, okay? More so than the extremities, more so than the arms or legs. This core or intrathoracic and thoraco-abdominal pressure plays a huge role in in blood pressure. So if you're somebody who does have high blood pressure, and I'm going to tell you, this is something that actually happened here. Patient came in, said he had been constipated, okay? Hadn't had a bowel movement in 3 days. His pressure was 176/84 when he came in, okay? Somehow, and I think it was probably the conversation, but this patient miraculously had to go to the bathroom while he was here. Went to the bathroom, had a bowel movement for the first time in 3 days, and his pressure came down 40 points, okay? So what I'm trying to tell you, and what I try to do for you each week, is try to put together the connections for you that I see in practice that are not right in the forefront of people's brains, because you wouldn't say, well, how am I eating? And the fact that I haven't gone to the bathroom in 3 days, how is that affecting my respiration? And how is that affecting my blood pressure? So again, the pressure here increases, encroaches on the thoracic cavity, encroaches on the lungs. Now you're working harder to breathe. That is now having a physiologic increase in your blood pressure. All this stuff increases anxiety, increases the heart pumping, increases the blood pressure, and so on and so forth. So nutrition is, in my opinion, the second or third most important thing when it comes to taking care of yourself when you have a respiratory condition. My first is always going to be exercise. I think exercise is the one single thing that anyone with any condition can do that improves most conditions, okay? How you take your medications and nutrition, I think, are kind of neck and neck for second. But nutrition, and again, mark my words, start to take notes. What I would recommend everybody do after this webinar is take out a pad of paper and start to keep a food diary. Keep a food diary for 1 week, okay? And the reason why I also want you to do this is because if you want to ask any questions of me, or if you decide to see a nutritionist, they're going to want to know, what have you been eating? And in addition to writing down what you eat, so you're going to write down the food you ate, the time of day, the food you ate, how much of it did you eat, how much did you drink, and also just take some notes. How do you feel? How is your breathing? Okay? If you notice that after you had a 12-egg omelet, okay, like they used to have here in New York at the Royal Canadian Pancake House, that you're more short of breath, well, we don't have to do a lot of math to figure out that that 12-egg omelet is making you more short of breath. So start to keep a food diary, okay? Write down the time that you ate, what you ate, how much you ate, and also some notes about how you felt. You can write down what you felt in terms of energy. You could write down how you felt in terms of shortness of breath. Another topic that a lot of people don't directly associate with pulmonary disease, but I tell you every week. I tell you every week the fact that between here and here we have a lot of systems, okay? The most crucial systems are the cardiovascular system, so the heart, the respiratory system, the lungs, and the GI system, okay? And they're so closely related that a lot of times when somebody reports discomfort in here, it's very hard to delineate, is it cardiovascular, is it pulmonary, or is it GI related, okay? GERD stands for gastroesophageal reflux disease. So this is acid reflux. And a lot of times, because of the increased pressure in the thoracic cavity, okay, when somebody eats or overeats, okay, that increases, and here's something in reverse. So here's where an increased pressure in the thorax, and that can come with restrictive diseases like interstitial pulmonary fibrosis. It could come with obstructive diseases like COPD and emphysema, okay, but any of these can increase the pressure in the thoracic cavity. And as opposed to now the abdominal cavity encroaching on the thoracic cavity, now the thoracic cavity is squeezing the abdominal cavity. And what can actually happen is you get a reflux or a backflow of stomach acid into either the esophagus, or if it's severe enough, okay, as it sometimes happens if you go to bed right after you eat, or you have a very acidic meal, this can actually outflow out of the esophagus and go into the airways, okay? It can go out of the esophagus, which is back here, go down the trachea, and now it's inside your airways, and believe me, acid is not supposed to be in your airways. So now think of the effect of that, which is now we're going to trigger an inflammatory process. What is that inflammatory process? The body is going to start to close the airways up. The body is going to start to produce mucus because all of a sudden we have an intruder alert. We now have acid in the airways, which is not supposed to be there. So the body says, I don't want that acid getting into the lungs. I'm going to shut down the airways. I'm going to produce mucus to trap it. And what do you think the impact is on your respiration? It's going to make it more difficult for you to breathe. So when I see patients, I always want to know, who is their pulmonologist, obviously. Usually it's a pulmonologist who's going to refer patients to me, but I also want to know who is their cardiologist, so that if something comes up in the course of rehab with their heart, I have somebody to talk to. I also want to know who their internist is, and I also want to know, in many cases, who their GI doctor is, and if they're seeing a GI doctor. And the reason why I say that, again, is because these systems are very closely related, and a symptom in one can overlap and create symptoms in the other. So if you have symptoms of reflux, so what are the symptoms of reflux? It could be a burning in your chest, okay? It could be, you go to sleep at night and you wake up with a sour taste in your mouth or in your throat. It could be a sore throat. It could be a hoarse voice, things like that. So if you're having those things, okay, and again, here's the connection again, here's the overlap. A lot of times people report these things with the inhalers that they take. So again, keep the main thing the main thing. We need to really assess you very carefully, and your doctor really needs to assess you very carefully to make sure that we're not having a knee-jerk reaction, okay? Usually we hear hoof beats and we think horses and not zebras, okay? And as I've told you many times about the book that I love, How Doctors Think, it's usually less than 30 seconds from the time that you walk into your office and start talking that the patient gets interrupted for the first time, okay? So we want to make sure that we don't think that a GI problem is a heart problem. We definitely don't want to think that a heart problem is a stomach problem, okay? And we don't want to think that a respiratory problem is a cardiac problem, and so on and so forth. We want to know what is what. So if you're having any of these symptoms, then ask your doctor to refer you to a GI doctor as well. Weight loss and weight gain. So this is a crucial topic as it relates to pulmonary disease and respiration and breathing, okay? And the reason why this is so important, and it seems like they're related, right? It seems like, well, if you have this problem, then if you have weight loss as your problem, then weight gain is the opposite problem. But one is actually going to significantly impact your respiratory system, whereas one is really the result of your respiratory system. So now, if you want to change your life, this is something that I say all the time, and I believe I said it first. I don't think I've ever heard it anywhere else. But if it is, I think it's a great quote. And the quote is, if you want to change your life, you have to change your life, okay? And what I mean by that is that everybody wants results. Everybody wants to be less short of breath. Everybody wants to be able to do more. If you're overweight, you want to be thinner. If you're underweight, you want to gain weight. If you're a brunette, you want to be blonde. If you're blonde, you want to be brunette. Everybody wants something different, okay? But very simply, when it comes to lifestyle change, and when it comes to COPD, when it comes to pulmonary fibrosis, when it comes to asthma, when it comes to cystic fibrosis, when it comes to lung cancer, okay? Any change that is small enough that it just happens to fit in your day very neatly and very comfortably is not going to be a big enough change to really improve you significantly. Okay, so if you want to change, if you want to see better results, okay, you have to make a change that's big enough to really impact your body in that way. And it's the same thing with nutrition. And you have to think about what is your motivation and what is the reward. So what is the reward for being overweight? Maybe it's that you like to go to, the most upscale she restaurants every week, and your reward is that you get to eat in these fancy restaurants and you enjoy food. But that means that, guess what? Climbing subway stairs is going to be difficult for you because now you've gained 25 pounds. A lot of times people come to me, and men have this issue more than women, but women have it also when it comes to being overweight, okay? Look at this slide here and understand that we talked about respiration. And what respiration, we need the diaphragm to contract downward. That diaphragm contracting downward creates a negative pressure, and that negative pressure elevates the rib cage and inflates the lungs. So now think of a hot air balloon, okay? So the hot air balloon being blown up is your lungs inflated. The weights on the side are what keeps that hot air balloon from taking off. So now imagine if you're 50 pounds overweight, and you say, how could I be 50 pounds overweight? Trust me when I say I see people who are 50 pounds overweight on a regular basis, okay? And now in women, the thing I'll say about women is that in women, the weight is often more distributed evenly throughout the body. Women will often have more of what we call a pear shape, okay, as opposed to men who come in and their weight is often sitting right in their midsection. But it can happen to women too, where the weight is sitting right in the midsection. So think of it like this: if you're 50 pounds overweight, or 25 pounds overweight, or even 10 pounds overweight, whatever it is, divide that weight by 2 and hang that weight off of your rib cage, okay? So if you're 50 pounds overweight and all your weight is sitting in your stomach, and I say to people, all the time, I say, it's not that you're that overweight, but where your weight sits is extremely detrimental to respiration, okay? Because think about it, if your weight sits in the middle and you have 25 pounds and 25 pounds here, think about how hard that diaphragm has to work to contract downward, and think about what has to happen to elevate those ribs to raise that 25 pounds on each side. So now you're working harder to breathe at every step of the way, okay? But what's really happening is that weight is pulling down on the rib cage, and when this pulls down, guess what we're doing? Again, increasing intrathoracic pressure, increasing intra-abdominal pressure. So a lot of times people come to me and their pulmonary function tests they're impaired, okay? So they may not be terrible, but they may show either an obstructive or a restrictive pattern, okay? And they report shortness of breath, and they say, you know what, last year I had an accident, I broke my leg, I was very inactive, I gained 25 pounds while I was on bed rest. Or they say, you know what, I've been on prednisone, and because of the prednisone, I've gained 20 pounds, okay? And the thing about this is that I can look at people and I know who is really having a respiratory problem, and it's not that you're not having a respiratory problem. If you're short of breath, we will call that a respiratory problem, okay? But very often what happens, I say to people, I say, here's what needs to happen. You've gained the weight, you've become less active, the inactivity has made it easier for you to gain the weight. Again, this is another cycle. So we talk about cycles every week. Nothing happens alone. The hip bone's connected to the knee bone, is connected to the ankle bone, okay? And again, the same thing, shortness of breath, inactivity. Inactivity, muscles decondition, you gain more weight, more shortness of breath. So if you want to change your life, you have to change your life, and we change your life, we help you change your life by breaking into these cycles. But in order to break into these cycles, you have to be aware of what they are. So again, a lot of times, if you're 50 pounds overweight, I don't doubt that you're short of breath, okay? But if you lose that weight, guess what? We see pulmonary function tests improve. In a lot of cases, they totally normalize. We've seen people go from severe COPD or severe restrictive disease to moderate, okay, or from moderate to mild. I lost 50 pounds, I take that back, I didn't lose 50 pounds. I lost 30 pounds myself this year, okay? I've been listening to my own webinars, and eventually it sunk in, and I said, if I want to change my life, I have to change my life. And I started exercising every day. I started watching what I eat. And you know what? Where I was short of breath going up the stairs, even not having a pulmonary issue, it changed everything, and I feel much better. And the reward is I feel much better, okay? For you, you have to really decide, is the reward worth it? I think when it comes to being short of breath, if you've experienced shortness of breath, we've said it before, but according to the American Lung Association, if you're short, if you can't breathe, nothing else matters. So I think for most people, it's worth your while and it's worth the effort to actually make these lifestyle changes. I think in a lot of cases, people don't know how to make the changes, and that is the reason for these webinars. And I think in a lot of cases, the medical community will take a position of medicate, give you more medication, give you, increase the dosage of medication, have you take them more frequently, as opposed to say, well, you need to lose weight or you need to get exercising. Pulmonary rehab is so under-referred by physicians. If every patient that needed to be in pulmonary rehab were here, we wouldn't be able to walk in the door, okay? It would be so full. But I promise you, in many cases, it's not necessarily that your lungs are getting worse. It's the lifestyle adaptations that you have made in response to that shortness of breath up at the high level. So again, let's say you're a stockbroker who works on Wall Street and you're used to taking the subway, 15 times a week. So that's 15 times a week that you're walking up, two flights of stairs. So that's 30 flights of stairs a week that you're no longer walking up because you don't take the train anymore because you get so short of breath. So 30 flights a week is 1,500 flights per year. So you think if you walk 1,500 flights of stairs less this year than you walked last year, that you're not going to get weaker, that your endurance is not going to get lower, that you're not going to be more short of breath? Absolutely, and nutrition plays a role in all of this. Okay, moving on. So again, just one more thing about being overweight, okay? If you're 10 pounds, let's say 15 pounds or more, if you're 15 pounds or more overweight, for every 5 pounds you lose, you're going to breathe a little bit better, okay? And if you're 25 pounds overweight, 50 pounds overweight or more, okay? I just had a patient come in who's lost over 110 pounds naturally. That's not gastric bypass surgery, that's diet and exercise, okay? It can be done. But the problem with weight loss is that often people don't know how to do it, and they don't sustain it long enough, okay? So a lot of times, you know, they don't know how to lose the weight, and they try to lose weight too fast, and then they wind up regaining the weight. If you lose, let me put one seed in your head, if you lose 1 pound per week, in a year, that's 52 pounds that you've lost. If you lose a half a pound a week, which is very simple to do, okay? In a year, that's 26 pounds. If you lose 2 pounds a week, which means you're really working at diet and exercise, that's 100 pounds in a year, okay? But again, if you're 50, 60, 70, 100 pounds or more overweight, that is your #1 priority, okay? From a cardiovascular point of view, from a respiratory point of view, from a metabolic and diabetes point of view, you have to get moving on that weight loss, okay? And I'll tell you this, for patients that come here and start exercising, every patient gets into better physical condition, but not every patient loses weight, okay? A lot of people think, well, now I'm exercising twice a week, I can have more to eat. But I promise you, you can out-eat any exercise that we do with you, okay? And the newer research actually shows that when it comes to weight loss itself, diet is actually more impactful than exercise, okay? But by doing it with exercise, we're actually increasing the chances of you retaining your muscle and losing fat. But again, if you're 40, 50, 30 pounds overweight, 100 pounds overweight, you got a weight emergency right there, and that is your #1 priority, okay? Even more so than the exercise, and it's very rare that I say something is more of a priority than the exercise, okay? Weight gain for the underweight. Now, this sounds like a problem that most of us would like to have, but here's where this is an issue. So I just talked about being overweight and how that affects respiratory disease. And when we talk about patients who are either losing too much weight or who have trouble putting weight on, okay, here's what the problems are, okay? Now, this side is a patient with emphysema, okay? And there's a lot of signs that tell me that this patient has emphysema. If you look at his neck, okay, and you look at the muscles around the neck, how overdeveloped they are, that's a classic sign of somebody who has a respiratory problem. And the reason for that is because we talk all the time about how the diaphragm is the main muscle of inspiration, but when you have a respiratory problem, okay, particularly when you have emphysema and your lungs become hyperinflated, okay, you have a hard time blowing air out, and now your diaphragm is not effective, that's when we start to use what we call accessory muscles for breathing, okay? And that's where we start to use muscles of the neck, muscles of the chest, muscles of the back, muscles in between the ribs, and that's why with this gentleman right here, you can see tremendously developed neck and chest muscles, okay? But what you don't see is a lot of beef, a lot of muscle on it. You see overdevelopment of his neck muscles. You don't see a lot of muscle on his chest. You don't see a lot of muscle in his arms, okay? And the reason for that is when you're not getting enough nutrition, okay? And again, we're talking about supply and demand. We talk about breathing supply and demand as it relates to activity. We're talking about nutritional supply and demand as it relates to calories. So if you're over-burning calories, so think about it. If you have a respiratory disease and instead of breathing 12 to 20 breaths per minute, you're breathing 40 or 50 breaths per minute, you can actually be burning 10 times the calories that somebody who doesn't have a respiratory disease is burning per day. So now think about that. You're burning so many calories, and think about how much you would have to eat to overcome those calories. That would probably fill up your stomach even more. And so the cycle here again is, in order to overcome the amount of calories that you burn, you have to eat so many calories. eating so many calories is actually going to increase your shortness of breath and therefore cause you to burn more calories, okay? So in cases like this, it's really important, and the thing is that when you start to lose body weight, okay, and it's not that you're trying, it's that when you start to lose body weight because of your respiratory problem, okay, and when you start to lose body weight because you're burning so many calories per day, eventually that fat is going to be gone, okay, but after that fat is gone, then you start to burn muscle. And now when you're burning muscle, okay, the problem is that now activity becomes more difficult. When activity becomes more difficult, all your muscles decondition. When your muscles decondition, they don't use oxygen as well. When you don't use oxygen as well, you start to become short of breath at lower levels of activity. So you see how these things just cycle and spiral and snowball out of control. And, you know, no disrespect to physicians. I know they're busy, okay? But in my opinion, if you're a cardiovascular doctor, if you're an internist, if you're a pulmonary doctor, and you're not addressing these lifestyle issues other than to give more medication, then you're doing a disservice to your patients, okay? And I'm not saying that you have the time to sit there and give your patients nutritional advice, but at least make the referral. Make it a priority. Let your patient understand how important it is and what a great role nutrition plays in their overall health and their respiratory health. Make exercise a priority. So I know you're not going to necessarily give your patient an exercise routine, and I know patients that you're not necessarily going to follow the routine, okay? How many times has your physician probably said to you, you need to work out more, and you say, okay, I belong to Bally's or I belong to New York Sports Club, okay? But do you go, okay? At least make the referral, at least make a contact with a pulmonary rehab program that's going to address these lifestyle issues with you, because again, you can feel significantly worse without having your respiratory system have gotten any worse at all. And so then we start to look at what these things are. So again, the patient that's breathing very hard and burning all these calories, again, that person is not going to tolerate 3 big meals. They may not tolerate 3 little meals, okay? But again, the key is to try to keep the calories up and to try to take small enough meals that it doesn't significantly encroach on the diaphragm and therefore significantly encroach on respiration. So this is something that's important to understand. I don't want to give misinformation in the sense of saying that every calorie is created equal. It's not, okay? There are some calories that are going to be much more beneficial to you and much more usable for your body for muscle building or for respiration, as opposed to some that are not, okay? But in general, the calories needed for 1 pound, okay, and that means gain or loss. To lose or gain 1 pound, you need to change 3,500 calories. So what I'm saying by that, okay, is that if you eat 3,500 more calories and you take in 3,500 more calories than you're actually burning over the course of the day, you will gain 1 pound. Let's do some math. If you take in 7,000 calories more than you burn over the course of a day or a week, you will gain 2 pounds. If you take in 10,500, you get the point, okay? If you want to lose a pound, you have to burn 3,500 more calories than you are taking in and than you're consuming. So now that's actually a convenient number, okay, because it's divisible by 7. So let's just think of what it would take to lose 1 pound per week. So to lose 1 pound per week means that you have to create a deficit of 500 calories per day. Now, that deficit can come by taking in 500 less calories. That deficit can come by burning 500 more calories. That deficit can come, and this is the way I like it best, is by cutting 250 calories and burning 250 calories per day. So if you cut 250 calories from your diet, okay, from your basal metabolic rate, which means how much it takes to support you when you're doing your basic activities, and you burn 250 calories per day, so now we've created a deficit of 500 calories per day, you will lose 1 pound per week. If you burn 500 and cut 500, you will lose a pound a week. You will lose, all right, my math is off now, you will lose 2 pounds per week, okay? And same thing as far as gaining weight, okay? In order to gain a pound, you would need to add 500 calories per day, okay? And that will gain a pound a week. Now, people say to me, well, what I don't want is I don't want you to cut activity in order to gain weight. Okay, a lot of times people say, well, I'm trying to gain weight. Isn't this exercise going to cause me to burn more calories? Okay, but that's actually paradoxical. Okay, let me explain to you how that works. So by getting in shape, that is actually going to improve your pulmonary function. And again, for those of you that believe you cannot improve pulmonary function, trust me when I say we have the data, we know you can improve pulmonary function if you do the right exercise. By actually getting into better shape, you can take a bigger breath with each breath. You can take in more air with each breath, and that will allow you to work less hard. So when you're working so hard to breathe, for the people that have a hard time keeping weight on or losing weight, okay, the work of breathing is where it's coming from. So by exercising, that little amount of calories that you burn during the exercise, a lot of times patients will be on the treadmill for 20 minutes and they say, oh, I only burned 120 calories. They thought they would have burned thousands of calories by now. But the calories that you burn during the exercise session are insignificant compared to the calories that you're actually going to spare by getting into better shape and breathing better. Another concept, and again, I'm not looking to give you the food pyramid here, okay? I'm not a nutritionist, and so if you really want a specific diet for you, I recommend that you make an appointment with a nutritionist who can do a full assessment with you. But some basic facts that you should know. The basic things that there are, the basic nutrients can be broken down into proteins, carbohydrates, and fats. And the point that I always want to make to people here is that there's a couple of things you need to know about the differences between digesting protein, carbohydrate, and fat. From a caloric perspective, both protein and carbohydrates have 4 calories per gram. Okay, they serve different functions. So protein, things like chicken, fish, meat, they have 4 calories per gram, but those nutrients are used to build muscle. Okay, carbohydrates have 4 calories per gram, and they're used for energy. Okay, fat has 9 calories per gram. So if you're trying to gain weight, okay, then you shouldn't be restricting fat. If you're 80 years old and you're losing weight at a rate of 3 pounds per week, you shouldn't be worried about having that ice cream sundae. Have that ice cream sundae, because at a certain point, your weight loss is actually your highest priority. That's what I mean about keeping the main thing, okay? Another thing to keep in mind is that a lot of times when people are talking about heart health, okay, especially this was more so in the 70s and 80s, but there was a big trend towards high carbohydrate, low fat diet, okay? And the problem with that, as it relates to pulmonary disease, is that the byproduct of carbohydrate metabolism is carbon dioxide. And when we talk about respiration and the medulla, or the brain, okay, and the brainstem, which is where the chemical control of respiration occurs, we say that the body responds, or the brain responds, to an increase in carbon dioxide, a drop in oxygen, and an increase in hydrogen ion, which means that your blood is becoming more acidic. So if you have a high carb meal, something like pasta, okay, and the byproduct of pasta metabolism is carbon dioxide, well, now your blood is full of carbon dioxide, and that's sending a message to your brain saying, chemically, breathe, 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 breathe. So now let's go back to that Italian restaurant. In addition to having a pound of pasta sitting in your stomach, okay, giving you a mechanical restriction to the diaphragm or a mechanical obstruction to the diaphragm contracting downward, increasing the intra-abdominal pressure, pushing up on the diaphragm, increasing the intrathoracic pressure, we now have another pathway that it's saying to you, you better breathe, buddy, and that's chemically, okay? So now you've got all these factors stacked against you, and I've actually had people who go into respiratory distress because of a big meal. A lot of people say, well, one meal is not going to do it to me. Sometimes one meal, it could do it to you, okay? One meal could be the tipping point that just puts you over to the edge, okay? Or pushes you over the edge. So maybe you weren't feeling so well before you went out to dinner. You're already having a little more difficulty breathing. Now you had a big meal, you're having mechanical difficulty breathing, and now, especially if you retain CO2, retain carbon dioxide, as many patients with lung disease do, it could be enough to be the triple whammy. So these are things that are important to keep in mind. So again, I'm not trying to give you a specific diet that you should follow tonight. I'm giving you concepts that hopefully will let you plan these things out and help you understand, well, what eating behaviors are going to make me more short of breath, and which eating behaviors are going to make me less short of breath, and which foods are going to make me more and less short of breath, and what quantities and what ways am I going to actually take them. That's where a food diary comes in very, very handy. And as anyone who sent me emails know, as anyone who has called me knows, I answer questions. So if you want to ask me questions or send me an email, I'm happy to answer them. The more information you can give me about yourself, the better answers I can give you. And of course, my goal is always to get you in my office, because I get so much more by seeing you, examining you, doing tests on you than I do either by phone, Skype, or email. As opposed to the big food groups before, there are some new food groups, and these are some strategies. Again, I'm not telling you exactly what you should eat, okay? But when it comes to grains, eat whole grains, okay? Again, it's not so much what you eat or how much you eat. The key is you want to get the most bang for your buck out of every single thing you eat. So if you're going to eat grains anyway, if you're going to eat bread anyway, if you're going to eat pasta anyway, at least eat the whole grain versions of it that are going to give you the nutrients along with just the increased carbohydrate and calorie. Things like cereals, breads, crackers, rice, pasta, things like that. And these whole grain foods should be eaten every day, okay? When it comes to vegetables, okay, eat more dark green vegetables, things like broccoli. Eat more orange vegetables, things like carrots. Eat more dry beans and peas, things like pinto beans and lentils. And if you're wondering where I'm getting this information from, you can get this information as well from a website that is called www.choosemyplate.gov. Okay, www.choosemyplate.gov. Okay. So again, now one thing about vegetables, okay, when it comes to green vegetables, particularly green leafy vegetables, if you are on a blood thinner like Coumadin, okay, green leafy vegetables contain a lot of the vitamin K, which is actually the antidote to Coumadin. So if you are on Coumadin, you have to definitely pay attention to how much green leafy vegetables you're taking. If you are taking more, then you need to discuss this with your doctor, because you may need a medication adjustment. When it comes to things like fruits, okay, the more variety, the better. Okay, choose fresh fruits, frozen fruits, canned or dried fruits. Go easy on juices, okay? Juices put a ton of sugar into your system. They don't give you the benefit of the added fiber, okay? And the fiber, even though not digestible by your body, as we talked about before, okay, will actually help with digestion and help you to eliminate. When it comes to milk, okay, choose low-fat or fat-free milk. Now, if you're trying to gain weight, okay, don't choose low-fat or fat-free milk. Choose high-fat milk, okay? Worry about your cholesterol a little bit less, okay? Or let your doctor know that you're trying to gain weight and you might be eating a little more fat. You might need a little more support when it comes to cholesterol medications. When it comes to meat and beans, try to choose the lower-fat varieties, fish, chicken. But again, if you're trying to gain weight, having some red meat might be okay. Things like baking it, broiling it, grilling it, okay? If you're trying to gain weight, fry it, okay? But don't fry it in lard or Crisco or, things like that. Fry it in healthy fats, okay? I'm not trying to get you to alleviate your respiratory problem, lose your weight, while at the same time having a heart attack, okay? So there are healthy fats as well. Things like safflower oil, things like canola oil, that can be used to fry in, that can be added to salads, things of that nature. Other things, when it comes to why some people lose or gain weight, okay? Practical aspects of food procurement, okay? Procurement is a word not often used, but I like it. Food procurement and preparation, okay? So if you're a chef, if you really enjoy the process of going to the store, shopping, picking out the foods, taking them home, cooking them, cleaning up after yourself, and now you can't do that because you're short of breath, that's going to impact you, and that's going to impact your lifestyle. So you need to try to do things that are going to help you, whether it's having a family member help you, whether it's taking a cart. And remember, we talked about how having a cart or a walker will help with respiration by closing the chain and assisting the respiratory muscles, okay? But again, if preparing the food is difficult for you, choose foods that are easier to prepare, okay? Don't make the choice to eat at McDonald's, Chris, or Burger King because it's easier for you, okay? Try to do things that are going to be helpful, but this takes strategizing as it comes to shopping for the food, as it comes to preparing the food, as it comes to cleaning up after the food. And here's a simple thing. Some people don't want to eat because then they have dishes at the end. Simply using paper plates is going to alleviate that problem for you. And again, there's a lot of things that we can talk about as it relates to these things. But again, planning ahead of time will often help. Other things as it relates to food, digestion, nutrition, and respiratory disease. When it comes to the respiratory system, you must be well hydrated, okay? If you are dehydrated, that dries out the airways. And one of the things that is a big problem for people with respiratory disease are secretions. So the more dehydrated you are, the thicker your mucus becomes, okay? The thicker your mucus becomes, the harder it is for you to clear it from your airways. And the harder it is for you to clear it from your airways, and the more that mucus stays in your system, the greater your chance of infection. Now, there are some people, okay, people with pulmonary hypertension, people with congestive heart failure, people with heart disease that are going to have a hard time with too much fluids. And so, again, talk about fluid intake with your doctor. People on diuretics are you're on a diuretic because you're trying to get fluid out of your body, but the diuretics can dry you out quite a bit. And the airways like to be moist. The lungs like to be moist. And so dehydration is a big factor in how well or how poorly you breathe. Now, we try to encourage people to drink water, okay? But let me throw a concept out there to you. So if you are trying to gain weight, then I would recommend never drinking water. And the reason why I say that is because water has no calories, okay? So why would you want to fill up your stomach with something that can't add anything to you in terms of nutritive value or caloric intake? So if you are trying to gain weight, my strategy would be every time you drink something like milk, drink something like juice, or drink something that's going to add calories to you so that you're not wasting any space in your stomach with water which is empty, okay? It doesn't give you any calories whatsoever. Now, the converse of that is that if you're trying to gain weight, if you're trying to lose weight, okay, then you should not be loading up with juices. You should not be loading up with soda, because now, in addition, you're filling the space, but you're adding what can essentially be empty calories. So if you're trying to lose weight, then really the only thing you should drink is water, because now think of the benefit. You're now filling the space, you're taking up stomach space and real estate, but you're not getting calories, and that can actually help you to eat less, okay? Other things to keep in mind when it comes to fluids, you really want to make sure that you're drinking plenty of fluids. Dehydration is definitely something that is the enemy of pulmonary disease. If you're on a diuretic, okay, that's going to dry you out. So a lot of people say, well, I have too much fluid. The diuretic will override the fluid that you take in. So you still should be taking in, plenty of fluids. People ask all the time, does alcohol count as fluid? Okay, here's the impact of alcohol on your body. It is a fluid. However, it has diuretic effects to it. So what that means is if you drink 1 glass of wine or 1 beer, then you're actually losing more fluid than 1 glass or 1 beer's worth, okay? So in fact, you're actually drinking alcohol, but you're having a negative fluid impact. So alcohol must be in moderation, and with many medications, you can't drink any alcohol at all. Here's another factor as it relates to alcohol in the respiratory system. Alcohol is a central nervous system depressant. Excuse me. So we've talked about the fight or flight response, and we've talked about rest or digest, meaning the sympathetic and the parasympathetic nervous system. Raja, I know you're at home thinking freeze, okay, but you know what I think about freeze. So alcohol is a central nervous system depressant. So now let's go back to the Italian restaurant. Pound of pasta in our stomach. Here's the mechanical obstruction to the diaphragm pushing down. The diaphragm is pushing up into the lungs, making you more short of breath. The carbohydrate content of the pasta is sending a chemical signal to your brain because now the blood is full of carbon dioxide, saying breathe, 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 but we got this pasta pushing up saying, I don't feel like breathing, okay? And now alcohol is a central nervous system depressant which suppresses respiration, making it even more difficult for you to breathe. So alcohol, okay, in very small quantities, certainly in moderation. okay? Is caffeine a liquid, okay? Is it a fluid? Does it count as fluid? It's definitely a liquid, okay? But caffeine also has a mild diuretic effect. So recently I've read some information that says that it doesn't have as much of a diuretic effect that people thought it did at one time, okay? I still believe caffeine is a diuretic, so I will say that you drink a cup of coffee, you lose more than a cup of water, okay? So if you are drinking caffeine, highly caffeinated beverages, coffees, teas, things of that nature, then I would definitely recommend increasing your fluid intake of pure water a little bit. But here's another impact of caffeine on the respiratory system. It is a central nervous system stimulant, okay? So the effect of caffeine is it's going to increase your heart rate, increase the pumping of your heart, it's going to increase your respiratory rate. And so now, again, if we are increasing your respiratory rate in general, when we increase our rate, we decrease the volume. And if we decrease the volume, less of that air actually gets into your lungs where you can use it. Now again, I'm not saying don't ever drink caffeine. I'm not saying don't ever drink alcohol. I'm not saying don't ever eat pasta, okay? Everybody is different. And so one thing that really has a negative impact on somebody else may not have the same negative impact on a different person. And so what I'm trying to say by this is keep the food diary, okay? In the book, we have a whole page, just of 5 pages of food diaries, because we want to get you to understand what is the impact of different foods, drinks, chemicals, and yeah, I say chemicals, especially when we talk about food, because God knows they're loaded with them, okay? And just let's look at the impact of this. So if you see, that you have the same breakfast every day, but today you had 2 cups of coffee instead of 1 cup of coffee, and your heart rate's higher, and your breathing is a little more rapid, okay, then we know that the difference is the caffeine. Salt, very important issue, particularly for people with cardiovascular disease or congestive heart failure or hypertension or pulmonary hypertension. So when you eat salt, okay, and I'm not just talking about the salt that comes out of the shaker, I'm talking about the fact that if you eat out or if you eat a lot of canned foods or processed foods, they're going to be loaded up with salt, okay? And the body likes equilibrium. So when you have salt, okay, here's the impact on that. So let's say you take in salt, okay, or let's say the body likes this concentration of water to salt, okay? And now you've just taken in, you've added this extra salt here, okay? The impact of that is that the body now has to add this much extra water in order to try to equalize that. Now, for some people that may be okay, but now let's talk about pressures again, okay? Except now we're not talking about thoracic and you're not talking about thoracic and abdominal pressures. We're now talking about the pressures in the heart and the blood vessels, okay? So if we think about this as one unit, okay, think of it as like a big water balloon. If we increase the plasma volume, okay, because we've just taken in an extra gallon of water, and believe me, it could happen. I've had patients who go home from the hospital after heart surgery, or I've had patients who have, half a pound of smoked salmon or lox, or they eat a pastrami sandwich or something like that, okay? And that causes them to take in so much more fluid, okay? And that fluid has several effects. Number one, it's going to increase your weight, okay? But it's not going to be fat weight, it's going to be fluid weight. So this may show up in the form of edema, okay? Your feet and ankles may be swollen, your legs might be swollen. It can show up in the form of increased shortness of breath, because if you have enough of it, eventually it's going to back up into the lungs. And it could show up in the form of increased shortness of breath and congestive heart failure, okay? So what's happening when you take in all this extra fluid is that the left ventricle has to work harder to pump. And if you in any way have a compromised left ventricle, that ventricle is not going to be able to meet that demand. And again, when the ventricle doesn't pump all the blood forward, where does it flow back to? It flows into the lungs, okay? So you may be more short of breath. If the fluid continues to build up, where does it flow back to? The lower body, okay? So salt in general is your enemy, okay? Periodically, I will have people who say, I'm actually low sodium, and their doctor has told them to increase their salt intake, or somebody who happens to be low blood pressure, in which case sometimes we recommend a little extra salt to try to get them to actually increase their plasma volume and increase their pressure. But for the most part, most of us take in too much salt. Another concept as it relates to respiration, there's a big controversy, should pulmonary patients have dairy products? Because there's this idea that dairy products will actually increase your production of mucus, okay? Do they? For some people, yes. For other people, no. So my point is, rather than make a blanket statement that you shouldn't be eating dairy because it's going to increase your mucus production, ask yourself these questions. First of all, is mucus a problem for me? If mucus is not a problem for you, then why would you want to eliminate a whole class of foods like yogurt, like milk, that's high in protein, high in calcium, high in very valuable nutrients, vitamin D, other things, when you don't have to? If you find that taking 1 tablespoon of yogurt means that you're coughing up more mucus or producing more mucus for 4 hours after that, then maybe it's not worth it, okay? But then you need to look at things of, are you allergic to dairy? Do you have lactose intolerance? Things like that. But again, I'm not going to say, does dairy increase mucus production, yes or no? For some people it does, for others it doesn't. So again, this is where your food diary comes in. If you say, drank a glass of milk, then I started coughing and I had a ton of mucus for the rest of the afternoon, then you have to be more careful for milk and with milk. And generally, the lower fat and skim dairy products are going to cause less mucus production than the higher fat contents. I think this is the last thing, or one of the last things, supplements, okay? People sometimes come to me with a list of supplements that includes dozen or more supplements, okay? Do I believe in them? Some yes, some no. The one thing that you have to understand about the supplement industry is that it is a multi-billion-dollar industry that is not as well regulated as the pharmaceutical industry. And a lot of times when you get certain supplements, particularly herbal things and things of that nature, you will see something on it that says, this statement has not been evaluated by the FDA. And so what that means is essentially, they're not even saying that what's in that product is necessarily in that product, let alone the effects of that product. So supplements, I believe in a good multivitamin. Vitamins and minerals are always going to be best utilized when they're gotten through food. So again, if you feel like you're not getting what you need, please make an appointment with a nutritionist. And I believe that is it. So again, I know this is not your classic nutrition lecture where I say eat 4 ounces of meat and 8 ounces of vegetables and 2 ounces of fat. But again, I'm not a nutritionist, okay? And I feel that these things cannot be brought out to the masses. I'm trying to give you concepts that help you to understand how these different things impact your breathing, both on a acute level, meaning how does this meal that I just ate at the Italian restaurant affect me for the next hour, 4 hours, 6 hours, 8 hours, and also on the long-term weight gain, weight loss. So I'm gonna open up for about 17 minutes of questions if people have them. Chris, do we have any questions? We have one question. Okay, what is the question? Who are we talking?
The question is from John R.
John R. Are you there, sir?
Let's see if I can find John over here. John, can you please read your question to us? You're on.
John R. Are you there?
Well, let me go
Okay, Chris will read his question. Okay.
Okay, John says, I take wheatgrass and NAC every day. Will this help my emphysema?
Okay, so will wheatgrass and NAC help my emphysema? So let me tell you the effects of that. Number one, I love wheatgrass, okay? I love juicing. I particularly love wheatgrass. Will it help your emphysema? The answer is maybe, okay? And I know that's not the answer you want. Should you do it? I would say I think wheatgrass does. I think it's anti-inflammatory. I think it's got nutrients in it that are very beneficial. NAC is N-acetylcholine, and it's often recommended for people with lung disease. There are some, as opposed to some other supplements, NAC has some very good studies out there that show that it does reduce inflammation, that it does actually reduce mucus production, that it does actually increase the ability to breathe. So I would say, is it going to help your emphysema? I don't know. I mean, again, emphysema, breathing is multifactorial, but I think that wheatgrass and NAC, and if you're talking about wheatgrass juice, then by all means it's great. I think that it could, and I think those are two worthwhile things. Do we have any other questions?
Barbara D., you're on.
Barbara D., are you with us? Okay, so again, we are obviously not that good at, having people ask their own questions. For some reason, I don't know what that is. Sometimes people don't know they have a mic, but Chris, what is Barbara D's question?
Okay, Barbara's question is, I have scleroderma with some pulmonary fibrosis and pulmonary hypertension. Can I still have a glass of wine with dinner? My daughter says no. I say perhaps.
Okay, so this is a combination of patient that we see all the time. So the patient with multiple medical conditions, okay, and this is a common scenario. So we see people with scleroderma, okay, which is an autoimmune disease that creates inflammatory pulmonary fibrosis or interstitial pulmonary fibrosis, and then pulmonary hypertension, okay? For me to say yes or no to this question is really not, it's impossible, okay? I don't know you. Just knowing those 3 diagnoses, it's impossible to say yes or no. I don't know your daughter, so I'm not going to get in the middle of a family feud either. But this simple question is, you have to ask your doctors this, okay? You have to ask your cardiologist, your pulmonologist, your rheumatologist, what is going to be the impact of wine on my system? So my questions would be, what is going to be the impact of wine on my scleroderma, if any? What is going to be the impact of wine on my pulmonary fibrosis and respiration? What is going to be the impact of wine on my pulmonary hypertension and my cardiovascular system? Now, they may say, well, here's what it's going to be, and you may be able to try it and see what is the impact, okay? I wouldn't try with 2 glasses of wine. I would try with, now, again, I'm not even saying what I would do, but with anything, you want to try things in moderation, in very, very small increments. So I would start with 1 ounce and see if there's an impact, but I would not start with any ounces without getting clearance from your physician. And it's not even those diseases that are the real issue when we talk about alcohol. It's really the medication interactions. And with scleroderma, pulmonary hypertension, and pulmonary fibrosis, you could be on 15 different medications. And so, we want to make sure that you're not going to have any of your medications diminished in effectiveness. We want to make sure that some of them are not going to be ramped up, okay? And we want to make sure that the interaction with the wine is not going to be harmful to you. So the answer to any specific question like that is going to be ask your doctor.
All right, Roger wants to try asking a question. Roger, can you speak to us? Roger? We can hear you, Roger.
Chris, I told you if Raja calls not to let her on.
I apologize.
Just kidding, everybody. I know Raja. She's one of my patients. Go ahead, Raja. You have a question? Raja, we can hear you. Speak, please. Raja?
All right, looks like Roger is having problems, so we're going to jump next.
Raja was insulted by what I said. Sorry, Raja.
We're jumping to
Okay.
Audrey B. Audrey, can you hear us? All right, you're live.
Hey, Audrey, we can hear you. Okay, I'm going to say I don't know the answer to that. But again, I don't recommend people taking NAC without their doctors, A, knowing they're taking NAC and recommending that they take NAC. So, I'm not an expert on NAC. I should know more about it than I do, and I will make it my business to learn more about it, that I will include in my book, but I don't know specifically about vitamin C and kidney stones. I apologize. Okay.
All right, next question is from April. April, can you hear us? April?
April?
All right, April's question was, is Qigong an effective exercise 20 to 30 minutes a day?
Okay, so we've gone off the topic of nutrition at this moment. I'm going to save Qigong for the next Q&A section because I know that a lot of people signed on specifically for nutrition. And I will talk about Qigong in the future. Please ask me that question or send me an email with that question and I will reply to it. But I want to try to stick to nutrition tonight. Any other questions, Chris?
Yes, the next question is from Marianne. Marianne N. You're live. Marianne?
Marianne?
Say something to us. All right, Marianne's question is, will a program of gluten-free food help the lungs?
Okay, so will a program of gluten-free food help the lungs? Again, the only answer to this is it might, okay? One of the ideas, there's a lot of people who are switching to gluten-free diets, And the main concept behind this is really reducing inflammation. So now here's something I read the other day, and I don't know how much truth there is to it, but there's a lot of people who they're saying are going gluten-free who really don't have a gluten allergy. So if you have a gluten allergy or an allergy to anything, then anything that's going to increase inflammation in one area is going to probably increase inflammation in other areas. So if you actually have a problem with gluten, where gluten and these types of foods cause inflammation for you and give you a problem, then by all means a gluten-free diet is probably going to help your respiratory system, just by nature of the fact that decreasing the overall inflammation in your body. Inflammation is really the killer, okay? Inflammation is negative on all systems. It's negative on the musculoskeletal system, it's negative on the respiratory system, negative on the coronary arteries and the cardiovascular system. So again, if you have an issue with gluten, then a gluten-free diet is probably going to help you. But if you don't have an issue with gluten, and there's ways to check these things and find out if you really have an allergy to it, then by all means, I don't want you eliminating foods that could otherwise be healthy for you. How many more questions do we have?
We have one more question.
This is going to be the last question of the night.
All right. Jan, can you ask your question, please?
Jan?
Jan, can you hear us?
Yes, I can. Right. Great question. I'm glad you asked it because I get to end on the point I like to start with. Absolutely they would, okay? And so again, breathing is multifactorial. So you asked about sleep medicines. Are they central nervous system depressants? Absolutely. So these can only be prescribed in a way that we know it's going to be safe for your respiratory system, okay? So the last, if you are already on the verge of respiratory distress, then the last thing you want is to take a medication that is going to suppress your central nervous system, okay? Likewise, if you have a high heart rate to begin with, then the last thing you want is to take a medication like theophylline, which is a huge central nervous system stimulant, okay? Same thing with, you mentioned antidepressants and other anti-anxiety medications. But again, this is where having the right doctor is so important for you, because you're trying to balance things out. And this is where keeping the main thing is the main thing. Keeping the main thing is so important, because let's think about that fact. Anxiety can be a paralyzing condition for people, okay? It can race your heart, it can increase your blood pressure, it can raise your respiratory rate, it can increase your shortness of breath. So then we come to a situation where we have what's coming first, the chicken or the egg? What is the main thing? Is it that you're so short of breath that this is causing anxiety, and then that anxiety is coming back and causing more shortness of breath? Or do you have an actual anxiety disorder which is now causing other things? So again, it really comes to a situation where you have to have a doctor who understands your situation well, who knows all of your medical conditions, who knows all of your medicines, who knows how they work together and how they interact with each other. And then all this stuff comes down to risk and benefit. So nothing is absolute, especially when it comes to medicine, especially when it comes to health, especially when it comes to these different diseases. So the thing is, you have to say, well, what is the risk involved in giving this medication? So is it more risky to give this medication that might suppress respiration, or is it more risky that the person doesn't sleep for a week straight, and that has its own set of, complications as well? So again, yeah, you're right. You're exactly right. You understood the concept perfectly, but these things need to be discussed with your physician and your healthcare team. Thank you all for attending. I appreciate it. So I will be out of town for 10 days, but I will be receiving emails. If you have questions, feel free to get them to me. Our next webinar is going to be on Wednesday, June 11th at 7:30 p.m. Eastern Standard Time. That's going to be a Q&A session. So I will not have a topic planned. You can email me questions ahead of time. You can call in and ask questions. Personally, I love hearing other people's voices, especially when they have accents from states that are different than mine. So again, feel free to email me questions. Feel free to call in that night. It's going to be probably an hour to an hour and a half. I never stick to my time frame because I talk a lot, but I think there's a lot of information out there. Again, Wednesday, June 11th, 7:30 Eastern Standard Time. You can register for it by going to our website, www.pulmonarywellness.com. Click on the webinar schedule link and register. Other things, if you want to see my previous webinars on ultimate pulmonary wellness and on better breathing techniques, you can also get to those on our YouTube channel. So go to our website again, and at the bottom click on YouTube. And very shortly, not very shortly, but currently, if you also click on our Facebook page, you will be able to see those webinars, and you'll also be able to see our interview with Dr. Sanjay Gupta. I thank you as always, respect, and thank you for signing on. Have a good evening.